Module 2, the law. Whilst there are a number of regulations that impact health and safety, in construction we're just going to focus on the Control of Substances Hazardous to Health Regulations 2002, COSH, and also the Construction Design and Management Regulations 2015, CDM. COSH, so the COSH regs. The first regulation we can look at is Regulation 7, which concerns itself with the prevention or control of exposure to substances hazardous to health. And in here the law tells us that every employer should ensure that the exposure of his employees to substances hazardous to health is either prevented or, where this is not reasonably practicable, must be adequately controlled. So a lot of the guidance we get comes from this regulation because of the control required. Under the COSH regs, there's also a requirement for a COSH risk assessment. This is Regulation 6, and it tells us that an employer shall not carry out work which is liable to expose any employees to any substance hazardous to health unless he has made a suitable and sufficient assessment of the risk created by that work to the health of those employees and of the steps that need to be taken to meet the requirements of the regulations. And Regulation 6.4 tells us where the employer employs 5 or more employees, he shall record the significant findings of the risk assessment as soon as is practicable after the risk assessment is made. So suitable and sufficient risk assessment. Suitable and sufficient, many conversations actually go on as what is suitable and sufficient. Ultimately, that is taking into consideration all of the hazards, all of the control measures, the amount of people that are there, and then completing a robust risk assessment. And it's good to know that that risk assessment must be recorded in writing if the employer has 5 or more employees. A deeper look at the COSH risk assessment. So the risk assessment you can see on your screen is one that's taken from the HSE website. It follows the 5-step approach as advocated by the HSE, and it looks quite simple. Quite often we see many COSH risk assessments that are quite big and often just follow safety data sheets. But if we look through this one, it is really quite simple. What are the hazards? Breathing in dust from cutting paving. What harm can be done and who could be harmed? Long-term lung damage like bronchitis and silicosis. And anyone involved in the cutting and anyone working nearby. What is this company actually doing? Well, they're using water to suppress dust, and they're also using protective goggles. Step 3, the second part, what else do they need to do for improve? And they need to get enough water, and they need to ensure that those involved should be wearing P3 respirators and earplugs. So as we can see, it's not a long and protracted risk assessment. The HSE themselves tell us that they do not wish to see reams of paper, they just want a suitable and sufficient COSH risk assessment. Out of the risk assessment then, we should develop a safe system of work. The safe system of work you can see here is one of the 3 safe systems of work that I've put with this course for free download. And let's have a closer look. And I followed the Assess, Control and Review framework, which we will look more at in Module 3. So assess, identify and assess. Using cut-off saws on paving, blocks off curbs can produce a very high level of silica-containing dust. Anyone breathing in this dust will be affected. So what controls can we put in? Well, if we look first at prevention, we can think about limiting the risks even before the work starts by using low energy equipment such as a block splitter. But we can also limit the number of cuts during the design. But even better than that, we can get the material cut off site and then delivered. So we sort of eliminate it. The controls then, we have water suppression, on-tool extraction, and also respiratory protective equipment, which should always be last and which we will cover in Module 4. For the review element, we've got supervise, maintain and monitor. That's the safe system of work which you can download free with this course. So the reality in the workplace, many companies are still being fined, hence the HSE's push this month on silica dust, on construction dust in general. And in this case, an organisation was fined £20,000 for failing to adequately control the exposure of employees to respirable crystalline silica. So during an unannounced visit, the HSE identified 2 employees that were using a power tool to cut flagstones without any respiratory protective equipment. So it is good to see that the HSE will act on this. So we're now going to have a look at another area of the COSH regs. We're going to look at health surveillance. Health surveillance is also within Regulation 6 of the management regs, but we are focusing on COSH. Regulation 11. Where it is appropriate for the protection of the health of his employees who are or are liable to be exposed to substances hazardous to health, the employer shall ensure that such employees are under suitable health surveillance. Health surveillance for silicosis should be considered for those involved in high-risk occupations, including construction, foundry work, brick and tile work, ceramics, slate, manufacturing, quarries and stonework. That's considered. But where employees are regularly exposed to RCS, health surveillance must be provided. So what could that health surveillance look like? If we look at the HSE document G404, health surveillance for those exposed to RCS, the health surveillance could include baseline questionnaires. It is always good to get a baseline understanding of the current health of employees coming into the organisation, especially if they're going to be exposed to crystalline silica. But remembering Section 60 of the Equality Act 2010, that we can't be prejudicial to anybody coming into work unless we have a sound reason for that. And health risks can be a sound reason. It could also include chest x-rays for silicosis and also lung function assessments. So the health surveillance is going to be determined by your risk assessment and also in discussions with occupational health professionals. We now look at the Construction, Design and Management Regulations 2015, otherwise known as the CDM regs. So the CDM regs places duties on everybody involved in construction. So we're now going to have a look at some of those duties. Clients, that's non-domestic. They must ensure that suitable arrangements are in place for managing health risks during construction. Designers involved in construction must identify and eliminate health hazards where possible and also reduce the remaining risk. Principal designers must plan, manage, monitor and coordinate occupational health risks in the pre-construction phase. Principal contractors must plan, manage, monitor and coordinate occupational health risks in the construction phase. This is while construction is going on. This is while the work is happening, where items are being cut. Contractors and small builders must manage any occupational health risks that their workers may be exposed to. And workers themselves. So workers must take care of their own health and cooperate with others on health issues. Cooperation is probably going to be in this area surrounding potential health surveillance, the wearing of RPE and the undertaking of fit testing. So coming to the end of the law module, a quick recap, a confirmation of knowledge before the assessment. The COSH regs require that exposure to substances hazardous to health are either prevented or where this is not reasonably practicable are adequately controlled. They also require that health surveillance for silicosis should be considered for those involved in high-risk occupations, but must be provided where workers are regularly exposed to RCS, respirable crystalline silica. and that a cost risk assessment must be written if the employer has 5 or more employees. Thanks for watching. Good luck with the assessment.